This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG Lafredo, and this week on the program, I'm coming to you from KRMC's Wallapai Mountain campus. My guest is Ashley Mao. She is a doctor of pharmacy, and she's just finishing her pharmacy residency here at KRMC. Ashley, welcome.
Hi, TG. Thank you for having me here today. It's great to be here.
Thank you. It's great to visit with you. You just heard me visiting with your colleague, Logan Sam.
I did.
Also finishing his residency. So you know that I love talking to the pharmacy residents. It is a magical time, and I like to catch some of that momentum. So I'm interested to hear about your presentation. Today we're going to talk about Narcan, the little spray that saves the day. And also, if it's okay with you, we'll do a little bit of kind of getting to know you first.
Yeah, let's do it.
All right. Who are you? Where are you from?
Yeah, so I'm born and raised Southern California. So I will always be a California girl at heart. But after I finished pharmacy school in California, I kind of wanted to move out of my comfort zone a little bit. And honestly, California was getting a little crowded for my taste.
It still is, I'm afraid.
It really is. So then I stumbled upon rural health, and I realized that, pharmacists, they have such a big impact in cities, but the immense impact in rural health especially was just not comparable. So that's why I started looking into rural programs, and then I stumbled upon Kingman Regional Medical Center.
How is your work as a pharmacist different here in a rural setting?
Yeah, so that actually kind of brings me to my next point of why, one of my favorite things of this year so far is really building that relationship with patients has just been my favorite thing this whole year. So essentially, a lot of people, they don't see the providers too often, especially in rural health. Some of my patients, they see their providers only about 4 times a year, but then I'm able to see my patients almost once a week. And it's gotten to a point that some of those patient visits, so I have an allotted 30 minutes with them. And honestly, those visits, they take maybe 5 minutes, especially if I see them pretty often. A lot of the times, they actually bring in other lab values or other things they just want to go over or just honestly talk to me about. And I think that's one of the biggest differences in rural health compared to back in the city. They have that kind of trust with us because we do spend a lot of time with them to kind of just sit down, get to know them, and over time, you kind of build that trust.
KRMC and Mojave County are what are known as medically underserved areas. Mm-hmm. And we've talked quite a bit on the program about the provider shortage, not just here, but all around the country. Do you see that pharmacists are often filling in the gaps in the care?
I do see that pharmacists are trying to step up, especially after the pandemic. So pharmacists have kind of tried to step up into that clinical role. So that's why we do have clinical pharmacists where they go through a residency training. So they kind of do a whole year of, it's kind of equivalent to 3 years worth of work kind of just crammed into 1 year. So you can imagine how much we actually learn out of school. And this is already after, we already have that doctorate degree. So really doing that extra year of work, you kind of are able to not necessarily diagnose. So pharmacists, we cannot diagnose patients, but essentially when we see a patient, especially on paper or just hearing the story about the patient, we can kind of have a feeling okay, where does the doctor want to go with this? What's the doctor's next steps? We are trained to kind of anticipate that and just be really a resource for not only patients, but also physicians, nurses, and essentially the whole hospital.
That is a bit about what led you to KRMC. Mm-hmm. Looking back, what led you to pharmacy?
Yeah, so actually, I guess a fun answer with that would be when I was barely turned 1 for my first birthday, my parents lined up a bunch of of those little profession toys all spread out, and then they put down a Tums bottle just for fun, and I just went straight for that Tums bottle. So some would say that is, I guess, fate, but really the real answer is I've just really loved developing relationships with patients. I've worked for CVS in the past, and I found that my favorite thing was really talking to patients, getting to know them, especially a lot of those patients, they came in for a bunch of just different medications, and some of them, they just wanted to talk about how their day was going. And with CVS, you really just gotta keep the line moving, but I just love pulling them to the side, talking to them a little bit more, and they opened up more. So I've caught different things that, some mistakes they would have made with their medications just from talking to them. So I would stress, just always talk to your pharmacist. They're there. Most people live within 5 miles of either a big chain or any kind of pharmacy. So just knowing that pharmacists are always available to talk is a good resource.
It is, as you say, it is incumbent on you to keep the line moving. You have a lot of patients coming in and a lot of medication to get out there.
Oh, yeah.
How do you balance that with your need to create that connection and nurture those relationships? There's a tug of war there, right?
Yeah, there really is. I think a lot of the times it does take some time to, keep that line moving, but also just seeing if the patient has any questions. And especially if you just ask the patient, a simple like, oh, how was your day? And just kind of filling in that gap. Sometimes they will tell you, and you'd be kind of surprised on how much patients will actually open up to you. I would have to say it also depends on, who the patient is and if they're regulars or not.
I wouldn't speak for the patients you've been seeing or presume to speak for you, but I do know that, we're dealing with a situation where a lot of patients, a lot of people are suspicious of the medical establishment. They are suspicious of expertise. If you do get those patients, how do you approach those conversations?
Yeah, so a lot of them I completely understand. It's understandable in terms of, I think we're always taught to question things, advocate for yourself. And so I tell patients all the time, you know what? Yes, ask those questions, advocate for yourself, but at the same time, try to keep an open mind to see, okay, you heard it from one provider. If you're really, really unsure, then ask a different one to see what their opinion is. So advocating for yourself is always going to be a good thing. But then also not trusting everything that you see on the internet. I think with the internet nowadays, it's so difficult to get right information and it's really confusing. So really just asking a licensed professional and making sure that who you're talking to is a licensed professional, I think is a big thing.
If you're just joining us, this is Focus on Your Health. I'm TG Lafredo, and this week on the program, my guest is Ashley Mao. She is a doctor of pharmacy, and she's just finishing her pharmacy residency here at KRMC. And Ashley, thank you for sharing that stuff. I just love to hear about who people are and where they come from.
Yeah, thank you for having me.
Thank you. We should now get down to business. You did a presentation for your program, and it's, as I mentioned earlier, it's Naloxone, the little spray that saves the day. So, Ashley, Dr. Mao, what is Naloxone?
Yeah, so I think to really understand what naloxone is, so just a little quick blurb, but naloxone is going to be a reversal agent for opioids. I know a lot of people have heard a lot of things about opioids, so some common ones are going to be like your heroin, your fentanyl, and then there's also prescription pain medication, so like your oxycodone and your hydrocodone. A lot of patients, they use it for chronic pain management, so it can be used for like arthritis, surgery recovery, cancer pain. However, a lot of those patients that end up using it tend to be older adults that have these issues. The problem is when we get older, our metabolism kind of slows down. And when metabolism slows down, our body kind of tends to keep it in itself. So then this can actually lead to higher drug accumulation. And that's what a lot of people don't think about. It can also end up with like drug interactions and also accidental double dosing. Sometimes we do forget things. So that kind of ties in why like older adults and opioid use, they kind of clash sometimes.
Mm-hmm. Let's talk about opioid use disorder.
Yeah, so opioid use disorder is essentially a condition that develops from long-term use or misuse of an opioid. So again, like taking an opioid the way that it was not intended, essentially having that strong urge or craving for the opioid, or even becoming tolerant to the opioid after years of taking it. So treatment would include like detoxification, so slowly decreasing the amount of opioids that you ingest, and also therapy and support groups are for patients who need it.
We know that some patients are using opioids in a legitimate medical way, but there are safety guidelines they need to keep in mind.
Yeah, so I would definitely talk to your local pharmacist or even your provider on really how to take that medication. And this kind of stems with all medications, not just opioids. It's just that opioids are such a dangerous medication, but it also helps so many people. So that's why I would urge everyone to just talk to their pharmacist about it. So the reason why we care so much about what opioids and opioid use disorder is because all of this can actually lead to an opioid overdose. So again, if patients are taking it incorrectly, or even they just built a tolerance up to it, and again, a tolerance just means that they've taken it for so long, their body just kind of gets used to it, so they end up taking more and more and more, and the more you take, it kind of puts you at that increased risk of what we call an opioid overdose. So an overdose is when you have too much of that medication in your body, and this is actually a life-threatening emergency that does require that kind of immediate medical care. So some signs and symptoms to kind of look for in other individuals, a family member, are going to be like a limp body, blue fingernails or lips, the inability to speak or be conscious really, vomiting or gurgling sounds, and just a slow breathing or heartbeat even.
And this leads us to naloxone, what it is and how it can save the day.
Yeah, so naloxone is a medication that rapidly reverses an opioid overdose. So again, opioid overdose is an emergent situation, so this wouldn't be necessarily considered a cure. It kind of just gives you enough time to get you to the hospital where they can finally take care of you. Seeing those signs and the symptoms is so important to see it not only like maybe in another family member or even a person just walking down the street. If you see it, then you kind of know, okay, like what's going on, and to call 911 right away. Going on a little bit about naloxone. So how it works, it essentially will kick out the opioid from the receptors in the brain. It kind of reverses that, what we call respiratory depression. So opioids, they will cause a little bit of difficulty breathing if you take too much. So administering that naloxone will kind of give you some time for the patient to breathe and to call 911 right away.
How is naloxone administered?
Yeah, so there's actually a couple different ways on how it's administered, but I think I'm going to delve more into the more common ones that you see, which is going to be a nasal spray. So this nasal spray, it really needs no assembly. It can just be sprayed up one nostril by just pushing up the plunger. There are different ones, so it can be given with a nasal spray with assembly. You don't see that one as often though, because again, it takes time to assemble, and honestly, it's a time-sensitive situation, so really trying to pull out that instructions and putting it together itself is not going to be the best. So same thing with the auto-injector or even the injectable with assembly. So drawing up that medication, most people, it's really, really difficult. So really, the most common one that you're going to see is going to be that nasal spray. Yeah, and then after you give the naloxone, you want to call 911 immediately and place the person in a recovery position. How I like to see the recovery position is kind of like if you're sleeping on your side, kind of hugging a pillow with your leg. So the leg or the knee kind of stops the body from rolling onto the stomach, so the patient doesn't actually end up rolling on their stomach, and then the hand supporting their head, just propping it up a little bit. And you do want to stay with the person until they either go to the hospital, or if the emergency services are taking a little bit longer, then they can actually give another dose of the naloxone, just because sometimes the naloxone can actually wear off before the opioids do. Opioids can stick around for a little bit longer than the naloxone, but it is completely safe to just give another dose if you're unsure.
With the growing use of opioids and the number of opioid overdoses we've seen in recent years, a lot of people are carrying naloxone. If you happen upon someone at the bus stop who appears to maybe have overdosed, is there a risk in administering naloxone?
Yeah, so there's actually no risk. I think that's one of the benefits of this medication. So yeah, sometimes, you have no clue what just happened to this person. They're kind of just passed out. They may have some of the similar symptoms, but again, you just got there. You don't really know what's going on. There's no risk in giving it to the person. You might actually just be saving their life without even knowing it.
How do people get naloxone?
Yeah, so that's a really good question. So a lot of people that actually take opioids nowadays, a lot of the prescribers now will actually give you a prescription for naloxone, so then they can just pick it up at their local pharmacy. However, for people that, maybe you don't take it, so you don't have a prescription for it, but, you have an uncle that's coming to visit that does take it, and you just want it in the house, to be a little safe. So they do provide it over the counter in some areas. Arizona specifically, we have something called a standing order, which essentially means that any individual can actually purchase naloxone, or its brand name, and many people know it as Narcan, can actually purchase it from any pharmacy in Arizona. And then also we have community programs that actually have a widespread availability through harm reduction programs. And sometimes you can even get it for free. I know the hospital, so Kingman Regional Medical Center, does give it out for free over in the emergency department to people who need it.
In addition to getting it at KRMC, there are other resources here in Kingman and Mojave County. We should touch on those.
Yeah, so you can always seek for naloxone kits over at Mojave County Department of Public Health. There's also Mojave Substance Abuse Treatment and Education Prevention Partnership. Also, we have Arizona's Youth Partnership. We also have our friends over in Kingman Harm Reduction Mobile Program. And then we also do have North Country Healthcare.
When we talk about opioid use disorder and we talk about the use of naloxone, why is community involvement important?
Yeah, so kind of like how we just talked about, sometimes, you just see someone at a bus stop. So community involvement is something that I stress a lot about, because overdose can really just happen anywhere. It can be at home, in public spaces, or even in healthcare facilities itself. So really that quick action is going to save someone's life. Bystanders with naloxone just in their purse or their backpack can actually just prevent those fatal overdoses, because again, giving it to a random individual, even though nothing's going on, but if you see those symptoms, giving it won't hurt them. It can actually even save their life. So just reducing that stigma around opioids really encourages people to seek help, which is why I'm honored to talk with you today, just kind of spreading that information and reducing that stigma, because really it can happen to anyone. How
can an individual in the community help?
Yeah, so just honestly being aware, even just carrying naloxone, so something like so small, just having it in your purse. You don't even have to administer it to anyone, but just having it available. So knock on wood, you actually need to use it on someone. If someone else needs it, then you have it available.
Ashley, tell me a little bit about the Arizona Opioid Assistance and Referral Lifeline.
Yeah, so sometimes a lot of people, they do have questions. So if you have any opioid questions, then there are actually trained nurses and pharmacists that can help. They have an OAR line, or the Opioid Assistance and Referral Lifeline. You can get into contact with them at 1-888-688-4222. You can really just ask them any questions you have on opioids, any concerns about the use of it, how to use it safely, and then just overall education on how to use naloxone even. And that number again is 888-688-4222. That is the Arizona Opioid Assistance and Referral Lifeline. Ashley, in the moment that we have left, what are some takeaways from your presentation here on opioids and naloxone? Yeah, so recognizing opioid overdose is just going to be that critical point to preventing life-threatening complications. So again, like key signs are going to be that unresponsiveness, so they won't really wake up no matter how many times you kind of shake them and ask them if they're okay. If they have that kind of slow or even no breathing, blue lips or fingertips, it's going to be that kind of symptom that you see if they're not really breathing or they're not getting enough oxygen in. Naloxone is going to be that reversal agent for the opioids. It's going to quickly reverse that overdose and restore that normal breathing. And really, there's no harm in giving that to anybody if you suspect they have an overdose. So someone that you see at a bus station, if you see them, they have those symptoms, it is completely safe to give it to them. And then really just proper administration of that naloxone, whether it be a nasal spray. So again, that is going to be the most common one that you see. It's just the easiest to give. You just give it up one nostril. It's going to be essential for that timely intervention and that opioid reversal.
That is Ashley Mao. She is a doctor of pharmacy, and she's just finishing her pharmacy residency here at KRMC. Ashley, thank you for your time today, and best of luck with your career and everything ahead for you.
Yeah, thank you so much for having me. It's been great to kind of just share my journey and talk about everything I'm really passionate about.
And that's the program. Let's focus on your health. I'm TG Lafredo. Thanks for listening. Stay healthy, and we'll catch you next time.